I think we all know that when we're prepared for something, the chances of success are higher. And so let's talk a little bit about preparing to undergo a lumbar fusion and how can we prepare in such a way to improve the outcome and decrease the failure rate of having a lumbar fusion. In our summit rounds this morning, we talked about failed back syndrome, which is basically having a lumbar fusion or other back surgery and having the outcome not match the expectations that were there preoperatively or having persistent symptoms. And we had a really good discussion on this idea that we can actually prevent failure by having an effort before surgery to help the patients prepare for surgery. And there's several things that I think patients should consider looking into. Number one, symptoms should be managed through the preoperative period. If a patient requires an additional injection, that's okay. If they're taking some medication to continue to manage symptoms, especially medications that are not narcotics, that's okay. We want the patients to manage their symptoms as much as possible going into surgery. Sometimes we put surgery on the schedule and then we're just waiting for the surgical date, but we want to continue to manage. It's important to stay moving, and that goes along with the first thing I mentioned. Patients should stay active as much as they can. And I think that the idea here is not to go and do stuff that makes the pain way worse, but to push yourself a little bit, to be as active as you can and to keep moving the best you can. Another opportunity is nutrition. Focusing and refocusing on eating the healthiest foods possible. That can lead to habits that can carry through past surgery. It's important for all of our health long term. Finally, I think that having a good discussion with your provider about what the expectations of the surgery should be. What's the surgery likely to improve? What things would the surgery maybe not improve? For example, lumbar spinal stenosis and treatment with a low back fusion, the leg symptoms are much more likely to improve than, say, the lower back pain. Now, patients may have improvement of their lower back pain, but I don't think that patients should go into a lumbar spinal fusion surgery with the expectation that they're going to be perfect, that everything's going to be fixed and that they won't have any more symptoms. I think that that would put them at risk of having what we would call a failed back syndrome situation. We are managing spinal problems. Sometimes surgery can help in the overall management, and surgery has its place and is very good for improvement of certain types of symptoms and not particularly good for improvement in others. And I think having that expectation understood before surgery is very important.